Good news here. Once again, California is leading the way when it comes to combating the virus. Joining us now to talk more about this is Dr. Ilan Shapiro, the Medical Director of Health and Wellness at AltaMed Health Services in LA. Dr. Shapiro, welcome.
A pleasure to be with you.
All right, first question here is, the CDC outlined who should be getting a booster, and state health officials have decided to interpret that very liberally. So should they be doing that?
Well, the most important thing is we need to see the science and what's happening in other parts of the world. Right now, we know that the vaccines have, been working well, and they have, an expiration date. Practically by 6 months, then the amount of antibodies that our body has to protect us, it starts going down. We saw it in Europe, we saw it in Israel, and most importantly, we saw the importance of actually having a reminder to our body, that's the booster shot, to make sure that we're protected, especially right now, because historically, last December, January, and February were actually the peak of the peaks that we had during the pandemic. Then we do not want to recreate that scenario again.
And Dr. Shapiro, are the side effects different with the booster than the original shot?
I have really good news. At this moment, they have not seen any difference. Practically most of us have had a little bit of pain on the arm, soreness, fever, body aches, but kind of the same way that your body is actually understanding how to produce those antibodies. That's the way that we're feeling.
And doctor, is the booster dose the same amount of vaccine as the first two doses that we got?
Right now, the recommendation for Pfizer is yes. For Moderna, they were trying to do a different dose. And for Johnson & Johnson is the same one. The beautiful part right now is that we can actually start combining vaccines. Before, if you started with the same horse, you needed to end with the same horse. Right now, you can actually combine. And we have seen on certain research papers that if you combine, for example, Johnson & Johnson with Pfizer or Moderna, you get a better coverage.
Doctor, is it likely that we'll need additional shots, do you think, even after this round of boosters? I think a lot of people are talking about how long is coronavirus going to stick around? Is it going to be like the annual flu shot that we get?
I do not have an answer, but I can tell you for sure what we need to be hearing. We start hearing new variants or new mutations of the virus. Yes, we probably will need an update of those vaccines. If we start hearing that our antibodies are going down, then yes, we will need one. And most importantly, we start seeing more deaths, complications, and people going to the intensive care unit. Probably we will need it to do it again. And the most important thing is that we have other vaccines that need a couple of them, like, for example, the polio vaccine. You need a couple of vaccines until your body actually understands and gets a hold of a long-term immunity. Then we're still on the part of understanding this virus. It's almost the first year that we have these vaccines. Then there's a lot of things to learn right now.
And doctor, right now it's recommended that if you got Pfizer or Moderna to get your booster 6 months after your last shot. Is that the beginning of the window? What if some time has elapsed? I mean, is there a danger zone somebody might be in or perhaps not being protected? Or is that just the window of time that we're looking at?
We started seeing cohorts and we were measuring antibodies and most importantly, people that were going to the hospital. And usually by 4 to 6 months, was actually the window, and for sure by 6 months was important to start getting that booster shot to make sure that our body remember how to create those antibodies.
A lot of people, Dr. Shapiro, they're just talking about how getting a booster, well, I don't need that. I already got the full, vaccination. I'm fully vaccinated. I don't need a booster. What is your advice to people out there who are still on the fence about a booster?
It's a great question, and I feel, because right now we feel that everything is changing, but the reality is that we are starting to get new information. We have never been here before. Then part of the frustration is making sure that we are understanding where we are with the virus and what's actually changing. The thing that we saw was, especially, we started seeing here in the US and other places, that when the immunity starts going down, even though that you completed your first set, you are exposing yourself and everybody around you. And that actually opens the door to, again, going to the hospital and all the complications, long COVID, and actually transmitting it to the community. Then I know that it's hard. And of course, we would love to actually have like a one shot and we're done. But sadly, the virus is actually giving us more headaches than we wanted to. And we need to adjust right now and make sure that we're protected. And especially right now that we have like a golden window of 2 weeks to make sure that everybody gets protected. before we start actually celebrating a beautiful Christmas and New Year's. And that depends on us. You know, it is on our hands to have a better Christmas and New Year's.
Dr. Ilan Shapiro, thank you so much for your insight and for your time this afternoon.
A pleasure as always.
Thanks so much. All right.